call the April 7th, 2020 Tuolumne County Board of Supervisors meeting to order. Please join me in a pledge to our flag. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with justice for all. So a number of us are smiling right now at what is going to be at least the way we proceed today and for the next couple of meetings. And so I'm going to ask a few things from the onset. And the first is that everyone, please have patience. Have patience when you call in with our staff, understanding that we are all experiencing a lot of new trials, if you will, as we go through this process. And so please be patient and know that we are doing our very best to accommodate the public with being able to communicate with this board, because that is so important. But on that, based on guidance from the California Department of Public Health and the California Governor's Office, and in order to minimize the spread of COVID-19, the board chambers are closed to the public for our April 7th Board of Supervisors meeting. However, we do want the public's participation. And so to protect public health and the safety of our Tuolumne County citizens, our meeting will be offered through a remote call-in line. These numbers have been published, but I'm going to repeat them now. It is 533-6581 or 533-6582. I'm asking a couple of things of our public. Please make your comments concise for us. Hold them to 3 minutes. And we want to hear your points, but please make them as concise as possible. When you call in, the folks that are monitoring the phones and helping us with this, the lovely Heather and Cece, are going to ask if you would like to be heard over the loudspeaker system, in which case you will be put into the queue, and when we go to public comment, you will come up as you have come into the call system. There will also be an opportunity if you want to give them your comments. They will write those comments and forward them immediately to the Board of Supervisors. I believe it goes to the County Council, to Ms. Riggs and Ms. Jamar, and they will be part of our record also. So with that, at this time, I'm going to ask for oral communication. Oh, excuse me, I'm sorry, Ms. Jamar. Thank you for the reminder. Will you please call roll?
Supervisor Sherry Brennan, District 1.
Here.
Supervisor Ryan Campbell, District 2.
Here.
Supervisor Anaya Kirk, District 3.
Here.
Supervisor District 4, John Gray.
Here.
Supervisor District 5 is Carl Runifer.
Thank you. Okay. Oral communication. It is that point where the public may address the Board of Supervisors. Would ask that you address us on any item that is not on the printed agenda. We have to take oral communication on items on the printed agenda as they come up on the agenda. So please, is there anyone that would like to speak to the board under oral communication? I think we're getting there.
Okay, go ahead.
Hello?
Go ahead and speak.
Are you ready for me to go ahead and start talking, addressing?
Yes, please. From the board here.
Yes.
Oh, okay. Sorry, there's a little bit of lag on the website. I will shut that down. My name is Jeff Musio, and I'm with Hazy Bulldog Farms. I first want to wish everyone health and confidence in this community. Today we stand in unprecedented times. This crisis has taught us many things over the last few weeks. Many jobs can be done at home. The economy is more fragile than anybody believed, and cannabis is, in fact, an essential business. Over the last few years, I have stood and delivered speech after speech on deaf ears. What I've been desperately trying to get across to the community is cannabis is a recession-resistant industry. Cannabis is wanted and needed by our community, meaning we voted for it and we need the jobs it creates. Cannabis won't lay off jobs during hard times like the rest of the business sector. Well, here we are. As our community is headed to 15-30% unemployment, Hazy Bulldog Farms is hiring and expanding. Hazy Bulldog continues to pay our $10,000 community benefit fee to the city of Sonora, while other businesses are asking for bailouts. After a couple of years lobbying to the city and the county, I think a few things are known about me at this point. I care about Tuolumne County, the livelihood, the physical and mental health of its community. Tuolumne County is my family's roots. I will fight for her all day, every day when needed. I will not sacrifice the good of the community for the good of my company, and I will not give up. I will not quit, ever.
Thank
What
you.
I'm about to propose is unprecedented as COVID-19 to this county. I feel the need for commercial cannabis has never been greater. We need an industry that will generate enough business and taxes to help the county the government continue with its essential services. We still have Walmart and large companies, but after the dust settles, the biggest impact of the economic hardship COVID-19 has brought us will be the small business impact. Hazy Bulldog wants to lead small businesses in our county into prosperity, put the economic hopes and dreams on my shoulders. What I'm asking for today in this county is to set an emergency ordinance for a commercial cannabis manufacturing and growing pilot program rolled out immediately. I have a property that meets all the current requirements for a grow, and I want to be called on to grow for the cannabis prosperity. The prosperity of this county, the prosperity of small businesses, the prosperity of agricultural industry in this county, which it was founded on. Hazy Bulldog Farms will sleep, sweat, grind, and repeat until this county's prosperity becomes a reality. I will work out, improve, and out-strategize my peers and competitors to become the man this county needs. Let me help this county. Let me grow essential medicine that I can help sell to dispensaries outside of our county and generate revenue from outside counties. Let me create jobs. My name is Jeff Musi with Hazy Bulldog Farms. I encourage you to make the right decision, not
Thank
because
you,
of
Jeff.
this crisis, but because this crisis has highlighted the weak spots in this county and how cannabis can directly and swiftly help.
Thank you,
Thank you,
Jeff.
Jeff.
We appreciate those comments. Thank you. Is there anyone else that would like to speak under public comment?
Bruce, are you there?
I will.
He gave up on us.
Anyone else that would like to speak under public comment? Okay, and apparently we missed somebody, and so again, I'm going to ask the public to be patient as we try and roll this out.
Okay, Bruce, hold on just a moment, okay?
Hang up the phone.
One more. All right, we're gonna try this again.
Yeah, this is Bruce Erickson, Certified Scientific Instruments in Sonora. I'm calling in to talk about the fact that these payroll loans that are and grants that are supposed to be coming out aren't, and there's a real big backup on this. And I think somebody there at the Board of Supervisors needs to take some leadership in terms of putting pressure on some of the local banks to get these things out. If small businesses are going to survive, like restaurants, et cetera, around our community, this is just a real necessity. And I think just as much as the virus is going to be a problem, there may be more people who have fatalities from the effects of the economic impact of this virus over the years that are coming in front of us. So if somebody can get on their horse and get something going in this respect, and it needs to be more than just a plea, but actually we need to have some kind of march on Sacramento or something, or march on the banks to get them off their duffs, because their lawyers are just slowing this thing up big time. related to that, just in terms of saving money, I'd like to reiterate that 3 of you guys are going to be off the board by the end of this year, and if you could go ahead and get off now, that'd be great, because the leadership that you have shown in terms of economics has been horrible, and we'd be better off with volunteers and saving the last 9 months of your wages. That's all I think I have to report now. Talk to you later.
Do we have anyone else that would like to make a public comment? Okay, seeing none, I'm going to go to staff reports. Are there any staff reports?
Good morning, Madam Chair, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. The Health and Human Services departments serve as a safety net for our community. And as your board is aware, the impact...
Can you speak up?
Yep.
Thank you.
And as your board is aware, the impacts of COVID-19 have been far-reaching. Many of our businesses have either closed or significantly reduced operations, which have left many of our residents without work. In the last 4 weeks, the Social Services Department experienced a 145% increase in the applications for food assistance and a 50% increase in the applications for cash assistance. Our medical assistance applications so far have remained steady at about 65 applications per week. Our food assistance program serve both families and individuals, and applicants who are eligible for emergency services are able to receive benefits in 3 days. Our cash assistance program serves families with minor children, and applicants who are eligible for emergency assistance are able to receive those funds within 1 business day. Although our lobby remains open, we encourage the public to continue to apply for benefits by calling 533-5711 or online at the letter C, the number 4, yourself.com. Additional members of the Health and Human Services Management Team are here to provide updates on their respective areas of responsibility. Thank you.
Thank you.
Good morning, Chairman Brennan, members of the board, Michelle Clark, Deputy Director with Health and Human Services. I'm here representing Child Welfare Services today. So each April we come to your board in partnership with the Tuolumne Resiliency Coalition and other community partners with a request to proclaim April as Child Abuse Prevention Awareness Month, where we urge all community members to stand with us during the month of April and all year long to work toward a community where children are no longer abused or neglected. Now, during these unprecedented times of standing together as a community to combat a health pandemic and so much uncertainty, children are at even greater risk as they lack connections to their teachers, their schools, their bus drivers, their counselors, coaches, and their extended family. So for many of our community's children, school is their only safe place and their only sure meal of the day. So today I come before your board and the community to say that we continue to be here. Your child welfare staff, your law enforcement officers, your behavioral health workers, your probation workers, your AmeriCorps volunteers, and other community partners continue to work every day to respond to abuse and neglect and to support families who need us. So now more than ever, I urge those in our community to stand with us and to do what can be done to support efforts to keep children safe. I would like to encourage our community members to check in on your neighbors. If you are worried or suspect a child may be suffering from child abuse or may be being neglected, please make a report. We continue to operate our regular hours, and calls can be made to 533-5717, and then our after-hours number is 533-HELP. So I wish you all health and safety, and thank you for your time today.
Thank you.
Good morning, Chair, members of the board. Michael Wilson, Behavioral Health Director. I wanted to give you a brief update on how our department has changed. So about half the workforce is working remotely, and we've staggered them so they don't overlap. Taking precautions and modeling behavior, social distance, and the proper use of PPE and washing your hands with soap and water and sanitizer is important with the population that we work with, that we model this behavior. We've mostly transitioned to telephone services with any face-to-face contact has to be taken to a supervisor, kind of hashed out, make sure that it actually is an urgent or a crisis situation or might prevent a hospitalization or deterioration. With that, you could imagine that our face-to-face contacts have gone down quite a bit, and our telephone contacts have really kind of skyrocketed. One example of that is in our substance use services, which are pretty key to what we do, working with the courts and others. And we've seen an increase overall in our services transitioning to phone. And I've had the pleasure of talking to some of our clients who kind of report out that they really appreciate that daily contact that they have versus just coming to a group every now and then. So that may be a strategy we've learned from this trying time to kind of carry on into the future. Overall, our services have decreased. We've seen from the first part of March to the second part of March, there was a 10 less crisis contacts, the psychiatric crisis contacts, from year to year, from last year of March to this year, though the number is the same. We had about twice as many actual 5150 assessments, but those did not result in hospitalizations. So more people seem to be seeking some contact and some maybe even reassurance during these times, but it hasn't resulted in a hospitalization. That's one of the things I'd like to take the chance here to do is to remind everyone that behavioral health is open, that we do provide crisis and triage services, and please reach out if you need us. We're there. Any questions about?
Yeah, can you share how they would reach out to you, please?
533-7000 is our crisis number. And again, we have crisis staff on, as well as some triage and outreach folks. And in any of these times, we're kind of changing our shape of our business. So if there's a way we might be able to help, we would gladly try to do that.
Thank you.
Good morning, board members. Justin Burtwhistle, Tuolumne County Tax Collector. April 10th is on a lot of people's minds, so I thought I'd better quickly cover the basics. Stopping the spread of the virus means a complete cutoff of the income for many households, which means the need to budget for only the most critical living expenses. Under circumstances, coordinated public health services, and as you know, many other county services, can be considered just that. Quite inconveniently this year, these services depend on receiving property tax revenue in early April. Further, the date is established by state law, so there's no realistic way to extend it. This county, as most California counties, is in a position that it must ask taxpayers to pay as soon as possible. For those who can't pay by April 10th, we still must ask that they pay as soon as reasonably possible. But depending on the circumstances, we may be able to grant relief from late penalties. They can submit a penalty waiver request form on available on my website with your late payment, and each one will be carefully considered. To encourage social distancing, we're asking payments be made by mail, internet, telephone, or there's a drop box out front of the county administration building. We do have one window open to take cash payments from 8 a.m. to noon, and we're staffed all day to answer the phone. I'd like to report that the number of requests for extensions is nothing compared to the number of households facing hardships. Property tax P.O. box has been overflowing every day recently. I think this means the community depends on us to make sure they're safe and secure.
Thank you. I see one more approaching. Sheriff Pooley.
Good morning, Board, Madam Chair. I just wanted to make you aware that within the last 24 hours, the Judicial Council of California has mandated the release of additional inmates. They have transitioned pre-sentenced, or pre-trial inmates to a bail of $0, which means we will be releasing inmates. We have a deadline of April 13th at 5 o'clock to meet this deadline, and we are going to start that now. I would assume your first question is going to be, how many inmates does that mean? It could mean up to 40 inmates for us. Any questions of me?
Any questions? Thank you. Any other staff reports?
Hey, Bill, I'm sorry. I did get a question that just came to mind. I'm sorry. When you identify those 40, would you possibly be putting them into a quarantine area? That way, between now and then, maybe mitigate?
After being released from jail?
No. If you identify your 40 today, has the idea maybe been brought up to quarantine those inmates
Quarantine?
prior to releasing them?
I don't think we can.
Okay.
I think we're
We'll
just
talk
gonna be.
offline, just something.
Yeah. We're going to start releasing them right away so we can meet
Okay,
the
so it's
deadline.
not, it has to be completed by that day. It's not going to happen on that day.
Yeah, I can't very well release 40 inmates on one day. It's just almost impossible to do to get all the paperwork and everything done. We're going to start transitioning now.
Okay, thank you.
Bill, obviously, I assume we'll be tracking repeat offenders that we release and then we end up arresting again.
Yes, we'll try to do that.
Thank you.
Anything else? Okay.
Okay. Seeing no other staff reports, I do want to remind the public that they can access our meeting live if they go to tuolumnecounty.ca.gov. What's the last one here?
Actually, if you go to that web page and then click on, if you scroll down, you'll see a little circle with a green circle that says board meetings. Click that board meetings, and it'll bring you right to the list of meetings, and there'll be an icon for iLive meeting. So,
Thank you. Okay. Will the clerk please read the consent calendar?
minutes of the meeting held on March 16th, 17th, and 30th, 2020. Accepting the certification of the results for the statewide presidential primary election held on March 3rd, 2020. Approving the revised Assistant Sheriff Probation Officer class specification. Adopting the 2020 Board of Supervisors Housing Policy Committee work plan. Approving the professional services agreement with Ascent Environmental, Inc. for the preparation of the Tuolumne County Climate Plan Action Plan. Approving the access easement agreement for county-owned property located at 17857 High School Road in Jamestown with Whiskey Lake Partnership, and accepting the protocol access easement agreement for the county across the adjoining property owned by the Whiskey Lake Partnership. Adopting the resolution determining that the total mileage in Tuolumne County's maintained road system is 608.79 miles as of December 31st, 2019. Accepting the annual reports of the account activities related to the Tribal Road Mitigated Traffic Mitigation funds, the Tribal Impact Mitigation Fee Activity, and accounts actively relative to the county's other traffic mitigation funds for fiscal year 2018 through 2019. Approving the contract with Highway 108 Safe Council to provide project management services for the Tuolumne County Defensible Space Program. Approving agreement number 1 to the standard agreement for professional service with the National Disaster Resilience Competition Architecture Services Phase 2 work with Lionakis. Approving the correspondence to the legislators regarding their assistance with the Federal Highway Administration to reinstate the original delivery schedule of the Federal Land Access Program project, the Evergreen Road reconstruction. Approving a contract with the County Medical Services Program Governing Board to receive $50,000 for technical assistance for the county local indigent care need grant, recognizing anticipated revenue and appropriations in the amount of $20,000 in the state revenue County Medical Services Program Health Systems Development line item for fiscal year 2019-2020. Approving the contract with AAA to receive $5,000 for car seat and event supplies through the 2020 AAA Child Passenger Safety Donation Program, and recognizing the revenue in the amount of $5,000 in the line item of miscellaneous income and appropriations in the same line item as special department expenses for fiscal year 2019-2020. Recognizing unanticipated revenue in the amount of $50,000 from the Kennedy Meadows Trust account and increased revenue and expenses in the economic development and promotion budget to upgrade generators at Kennedy Meadows Resort. approving the reappointment of Paul Slummons to the Tuolumne County Transportation Council Citizens Advisory Committee as a representative of District 2, appointment of Matthew Rose and John Featherstone to the Tuolumne County Commission on Aging, appointing Julie Fredericks to the Carter Cemetery District, and adopting a resolution proclaiming April 6th through 12th, 2020 as Public Health Week in Tuolumne County.
Would any board member like to pull an item? Okay, is there any public comment on the consent calendar? Does have a 30-second delay? So we have a 30-second delay, so again, I'm going to ask for everyone's patience. Okay, seeing no public comment on the consent calendar,
And move on the consent calendar, Madam Chair.
I have a motion from Supervisor Rotifer. I believe the second was from Supervisor Kirk. Will the clerk please do roll call?
Supervisor 1, Sherry Brennan.
Yes.
Supervisor 2, Ryan Campbell.
Aye.
Supervisor 3, Anaya Kirk. Supervisor 4, John Gray, District 4.
Aye.
Supervisor 5, District Carl Rodefer.
All right. Thank you. Will the clerk please read item 21?
This is a presentation and planning status update of the novel COVID-19.
Good morning, Madam Chair, members of the board.
And Rebecca, you may have to get closer to the mic so John can hear it.
Okay, thank you. Good morning, Madam Chair, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. In 3 short weeks since our last board meeting, the number of coronavirus cases worldwide grew from slightly 182,000 cases to over 1.3 million. The surge of COVID-19 cases has hit parts of the nation and parts of our state very hard, but Tuolumne County's numbers have remained steady at 1. This is in part because we are blessed to live in a community who cares for each other's well-being by abiding by the stay-at-home orders, practicing social distancing, and maintaining healthy hygiene. I must also acknowledge Dr. Sergenko's leadership as he has guided us through this crisis. I must also acknowledge Steve Boyack and the entire public health team, county EOC, community and government partners who have worked tirelessly to support our county. Today's presentation will provide updates since the last board meeting and also information on the county's planning activities.
Okay, we'll get started with slide number 2. I will go through these statistics as they were at 6 p.m. last night on April 6th. If you were on any news channel this morning, these statistics have changed, but I will report out as they were last night. So in the United States, we have almost 331,000 positive cases of COVID-19 here in the United States, with about 8,910 deaths as of last night. In California, a little over 14,000 cases and 343 deaths. Now, Rebecca did report out about the 2 positive cases in Tuolumne County, and I just want to give you an update. So case number 1 has recovered. That case had a travel companion, and that companion is quarantined at this time, and we are monitoring to make sure that that companion completes the quarantine period as required. The second case has completely recovered, and I just want to point out, by the time the county was notified about this particular circumstance, I'm going to call it the case for HIPAA protection purposes, had nearly recovered, and now that person has finished their quarantine period, and we are no longer looking at that person. We can move on, please, Lisa. Slide 4. Thanks. All right, so moving on, I want to talk a little bit about increased communications and our department operations center and staffing support. So the operations and staffing have expanded in our DOC. We are doing something called a daily incident action plan. I'll refer to it as an IAP. And that IAP has been expanded to include advanced planning regarding surge, medical surge. We are actively engaged in preparations to increase our contact investigations as needed, including training of additional staff at the Public Health Department, Social Services, Probation, the District Attorney's Office, and the Sheriff's Office for that purpose. We have robust management in the logistics section. We are monitoring febrile respiratory illness surveillance from healthcare providers pursuant to the health officer order, and screening of all essential staff upon beginning their workday. We have increased public messaging, and we have also stood up, as your board is aware, a COVID-19 call center. And between Tuesday of last week and Tuesday of this week, we've received and responded to 84 calls. We continue to support and receive support from our Emergency Operations Center, especially in areas such as coordinating operational area briefings, advanced planning, and working with our business community. Next slide, please. We've also established a joint information center that is primarily operated and managed out of our EOC with multiple agencies that have their PIOs all together to discuss as needed to enhance our combined and cohesive message so that it is coordinated and we are getting messaging in a coordinated fashion to the public. Through our medical health operational area program, we continue to manage an immense amount of volume of resource requests from our healthcare facilities. And now, when Dr. Surgenko speaks to our masking protocols from our own internal departments. Next slide, please.
So good morning, Chair. Good morning, Board. Eric Surgenko, your interim health officer. One significant change with over the ensuing period since we've last appeared in front of the board is we have established a area coordination team, which we're calling the Yosemite Gateway Area Coordination Team. This was done with the approval of the board chairs of the 3 counties that are involved, Madera, Mariposa, Tuolumne, along with their CAOs, sheriff, and emergency management programs. As well, the superintendent of the park, along with the chief ranger, are part of a multi-agency coordination group that met on the 26th of March and approved this construct, and then since then have established a battle rhythm of meeting weekly. That first meeting was held on the 1st of April. The intent behind the area coordination team will be to develop strategic goals that apply over the region and establish objectives that will allow us to have a unity of effort in the Tri-County One Park area. That said, the counties and the park themselves retain operational planning, control, and implementation. So execution of a plan happens at the local level, but coordination happens at the area level. Next slide, please. So this unity of effort as a Tri-County One Park region will allow for a development of what is called a common operating picture. That's a common set of facts that we can all operate from and develop objectives from. That will allow for us at the EOC and DOC levels to make more informed decision making, including all 3 counties' perspectives and recommended actions. As possible during this pandemic, It will allow for the sharing of resources. And honestly, the term deployment's a misnomer. It's more sharing of virtual resources, and we can see that on the next two slides when we get there. It will allow us to centralize and coordinate our approach to public information and messaging, sharing best practices, and then coordinate action planning and advanced planning efforts. Next. So the construct, again, of the area coordination team is that we will have a multi-agency coordination group that consists of the senior officials of each of the counties in addition to the superintendent and the chief ranger of the park. They will provide guidance to me as the area coordinator. Supporting me in the role as area coordinator will be a joint information center, again, largely virtual, but sharing best practices amongst the JICs through the 3 counties in the park. We will have a planning branch that will develop both advanced plans and integrate action plans with the counties in the park. And then there's an intelligence and epidemiology branch that will provide insights into how the disease is progressing and looking for novel treatments, novel activities that can help us mitigate that disease. Next slide. So this is the laydown of that coordination team. Again, I'll be serving as the area coordinator. I'll have admin support from Laura Glenn, who is a systems analyst that works for us in Mariposa. The Joint Information Center lead is Christy Mitchell. She's currently the Sheriff's PIO for Mariposa, but will be dual-hatted in the role as sharing best practices amongst the JIC leads across the 3-county, 1-park region. Then working for or in support of the counties will be an intelligence branch. This is, again, in a disease outbreak, intelligence is epidemiology. That is, how is the disease behaving? Where is it going? What is it doing? So supporting us in that is Adriana Nunez. She is a PhD candidate from UC Merced in their public health program. She's also an MD. So that MD-PhD combination brings us a great degree of insight. So she's doing daily epidemiology reports for us, looking at the persons under investigation, looking at the febrile respiratory illness that's being reported through the health officer's orders, and then looking at other trends that are occurring throughout the state, such as hospital surge data that we're able to download on a daily basis. Also supporting us in the intelligence branch is an analysis unit. This is a group of UC Merced graduate students that are available to us through Paul Brown, who is a professor in public health. And essentially, this is our skunk works. For those of you who remember that, is if we've got questions, they will look up answers for us and sort of do those deep dives on things like masking, does it work? Hydroxychloroquine, what are the actions with that? So those things that are both in the scientific realm and in the public realm, they'll do one-page fact sheets for us and then produce those so that we can have better informed actions. On the planning side, Christina Allen is my senior admin analyst on a daily basis. She is another PhD grad from UC Merced. She is coordinating the planning efforts. Eric Scott in the action planning unit is a type 2 planning section chief. He is currently the Wawona district ranger, but is coming to us, supporting us from the park, and working with the DOC planners in initiating their incident action plans. And then an advanced planning unit is Dana Tafoya. She's working with the teams on developing surge and what we call campaign plans. That is, how do we move through all phases of the pandemic? And then Elaine Jaramillo is supporting as a situation unit leader. So that's the area coordination team. The other significant change that's happened since the last report was we've come out with 3 new health officers' orders that are in support of the California governor's and state health officer orders that were issued back on the 19th of March. Again, everything that I think I've done as a clarifying order was already addressed in the state health officer's order, but does provide that necessary clarity so that we don't have any questions about what are essential and what are not. Next, please. So the 3 most recent orders, the first was yesterday, and that was a clarification of what is an allowable activity within the county and what should people be doing in terms of staying at home. This, again, enunciates a lot of what's already incorporated in the state health officer's order, but very specifically lines out what is not permitted under essential services. The same was true of an order that I wrote on the 3rd of April, on Friday, which was clarifying the short-term lodging requirements and limiting those short-term lodging availabilities to people who are providing essential services under the state health officer's order, those people who require sheltering in place to be away from sick individuals, that is to say sheltering our at-risk population, or where needed to provide isolation and quarantine services. The other clause that we added to this was to provide for other emergency sheltering needs, such as domestic violence victims. And then the last of the new health officer orders was issued on March 26th, and this is a screening for febrile respiratory illness. This asks healthcare providers to look for a new cough, a new or worsening cough, new or worsening shortness of breath, or fever in their patients. That's a classification for what's called a febrile respiratory illness. If that criteria were to be met, the healthcare provider was directed to have that person isolate for 7 days or until 3 days after the fever had broken, whichever is longer. It also asks that those people that are isolating contact their close contacts, people that were within 6 feet of them, for 10 minutes or greater, and have them quarantine. We also ask employers to screen their employees for also those signs and symptoms of a febrile respiratory illness and exclude them from the workplace for 7 days. And the last clause within this health officer order is actually for us as residents of Tuolumne County to consider, do we have symptoms? And if we do, we should stay at home. And this FRI order was made with the idea that we are currently facing a shortage of laboratory testing. We can't test everyone who would like to be tested, nor can we even test everyone I would like to have tested. So the assumption is for our county, if we have someone with these signs and symptoms, they may be infected with COVID, and so the prudent thing to do is treat them as such and place them into isolation. Next. Last week, Governor Newsom and Sonia Angel, the state health officer, issued guidance on community masking. This was in reaction to changing science. What we know, what we have done with pandemic planning is focused on pandemic influenza. And pandemic influenza, really, you don't spread it until you have symptoms. But what we've learned about the COVID-19 virus is that it can shed asymptomatically or pre-symptomatically. That is, you could be carrying it with you and spraying it in droplets as you come within 6 feet or 3 feet of distance of people. And so the science of what we know about masking has shifted, I would have to say, slightly in favor of masking instead of away from masking. And so there was guidance that came out from the state. Last week we issued some clarifying details on that. But I think an important point that we need to share as a community is that wearing a cloth mask is not meant to protect you, the wearer of it, but rather the community members around you, because you're capturing the virus, the droplets, in what you're breathing out. It really will not protect you from the things that you're breathing in. We have fairly good science that suggests it does not. A little bit on testing. This continues to be conducted locally. Again, it can be ordered by any clinician based upon their assessment of the patient. We're not restricting on what people order, though we do ask them to be prudent because we really do not want to backlog what we have as a laboratory capacity. The tests themselves can go through private labs, either Quest, ARUP, or LabCorp, through the hospital's lab, or the San Joaquin Public Health Lab. As of yesterday, there have been 266 tests that have been performed. One of that obviously was positive. 260 of those are negative, and about 5 results are pending. We have about 8 to 10 tests that are being performed on a daily basis. I think that, along with the FRI surveillance, is allowing me to say that we aren't seeing any community transmission. Again, I wish we had some more testing capability, but like everywhere else in the state, we're seeing a lack of capacity. And again, it's a supply chain issue, not so much an issue that we can resolve locally. With surge planning, again, we're working in conjunction with our healthcare delivery, which includes the hospital, ambulance, EMS, other first responders, in looking at what needs need to be addressed should we surge. And that includes planning for additional healthcare personnel. The state last week initiated the California Health Corps. That is a layering on top of the disaster health volunteer system that already that is already in place and working to attract additional staff as needed. We're working through the Mohawk process to assess what we need, where our gaps are in supplies, things like IV fluids, equipment like ventilators, and then we're looking at where we'll be expanding into the hospital and other places throughout the county as needed. I'd like to turn over to Mrs. Spino for comments on homeless management.
In preparing for surge, we must also remain alert to those who are not sick enough to remain in the hospital, but are unable to isolate or quarantine in place due to their housing situation. On March 20th, the county issued a request for qualification, which was designed to identify local hotels who are willing to assist the county in housing the homeless that had tested positive for COVID-19 or were exposed to COVID-19 and they needed a place to quarantine or isolate. It also allowed us to gauge the costs associated with this planning. Yesterday, the county EOC issued a request for proposal to begin the procurement process of securing and negotiating contracts with local vendors. This level of procurement is necessary to enable the county to secure funding from multiple government sources to help support the array of services required to help the homeless quarantine or isolate in place. County EOC, our homeless prevention coordinator, and HHSA staff in partnership with numerous community organizations will all work together to meet this need. We plan to prioritize homeless who have been tested positive for COVID-19, homeless who have been exposed to COVID-19, and homeless with compromised health or aged. There are many funding sources in place, but we must be strategic in our approach in this effort.
Okay, I will continue from a communications perspective. So daily updates continue to be sent to community members, community stakeholders, county staff, and the media. Public health is utilizing social media, our county website, traditional media, and paper education materials to keep the public as up-to-date as possible as we continue to manage the COVID-19 response. We have stood up our joint information center to coordinate messages across essential service, infrastructure, agency, coordinated message requirements. Next slide, please. We'd just like to remind the public that the Public Health DOC has stood up a public information call center. That call center is open from 9 a.m. to 5 p.m. every weekday. The phone number is 533-7440. So if the public has any concerns, they can certainly call the call center and we will respond accordingly. The hospital, Adventist Health Sonora, also has a health advice line that I want to remind the public of. It is available Monday through Friday from 9 a.m. to 6 p.m. The phone number 536-5166, and the hospital will again also respond to COVID-19 questions. There is also an advice and chat symptom checker at the website www.adventisthealthsonora.org. Next slide, please. So we also want to remind your board and the public that we are maintaining communications through the Public Health Facebook page and the Tuolumne County website, as well as information can be found at the California Department of Public Health website and the Center for Disease Control website. So that concludes our presentation for today. We'll be happy to answer any questions.
So I'm going to start with a quick comment and then a question, follow-up. Dr. Surjenko, I want to thank you for how proactive you have been in really bringing resources for our area that we simply don't have. And I point to this Yosemite Gateway Coordination Team. I think I first was approached about this conceptually on March 26th, and within 2 days you had a meeting set up, And within a week of that, the team was in place with roles assigned. But more importantly, I really want the public to understand the resources that you brought from out of the county, primarily through UC Merced, that have the latest available information and science. And I just want you to know that I've talked to some of my fellow supervisors in other rural counties, and I believe this is going to be a model. This is going to be something that other counties are going to look at and say, how do we coordinate to effectively get the best information available and, as you said, share resources virtually. And while we're coordinating, I also want to emphasize that you have respected and assisted the individual jurisdictions, and I would point to our Forest Service closure. That was something that was brought up. The other two counties weren't necessarily experiencing that, Mariposa being more heavily dominated, by Yosemite National Park. And you recognized immediately what our difference was in what we were experiencing with visitors coming to the county and congregating. And I believe within 24 hours you had a letter that was supporting that the Stanislaus Forest closure for Tuolumne County. So I want the public to really understand how we are maximizing through your leadership in this effort to bring resources that we do not have in our rural communities, and that really is the most valuable updated scientific information, literally as it is rolling out. And yet having the flexibility to deal with what are still individual county issues as they come up. And so again, I am, when I look back at what has been accomplished over the last 2 weeks, it is nothing short of amazing. So my question, though, really goes to, I think, Mr. Terry. And as we talk about communication, the public, it's important to understand that the message is still shelter in place, stay at home, social distancing. We cannot forget how important these pieces are. And part of our messaging campaign, I think, from the county's perspective, is how do we message that outside of the county? And can you give the board an update on what we're looking at? Ms. Riggs?
I know Jason has been working on this a bit, but Christina's actually been taking the lead, her and Heather, on getting and contacting individuals and different media outlets. So I'd like Christina to speak to that.
So thank you for that. Christina.
Good morning, Board. I have my own mic back there. I guess I probably could have used that. But Heather and I have been working, began Friday, reaching out to Bay Area, Central Valley radio stations to get PSAs, public service announcements, broadcasting throughout the areas where we know that our travelers come from, and actually have reached out locally with Clark Broadcasting. There was a PSA this morning because, as we know, many people who have their second homes up here or travel here listen to our local radio stations and go on to My Mother Lode for current events. So we have worked locally with Clark Broadcasting. We have worked with KGO, KNBR, Coit, KMVQ, et cetera, San Francisco, Napa, Oakland, San Jose, and all of the 9 counties surrounding San Francisco. We have reached out to a marketing company who has helped me get the word out. It's not quite there yet, but this Central Valley will be reaching out to Turlock, Oakdale, Manteca, Riverbank, as far reaching as Tracy, to do public service announcements, banners on their websites and their radio stations, and some news information. Our chair, Sherry Brennan, has an interview with Mark Trumpner tomorrow morning, and he will be doing some news work locally with her. Of course, if there's others that the board would direct me to reach out to other communities, I would be happy to do that. But that's kind of our idea of blanketing. And then we'll have a half-page ad in a Manteca. That was kind of a bonus that I got. Half-page ad in a Manteca newspaper.
Thank you for that update. And then I would also ask someone to report on the messaging that is going on with Caltrans.
Good morning, Jason Terry with County OES. We've reached out to Caltrans as part of our county information system, trying to put up advertising and signs that say, the county recreation areas are closed, specifically maybe call out specific areas that we know are highly vacated, or not highly vacated, but highly visited, such as Pinecrest Recreational Area. The contact that we have had with them indicates that they're going to have a larger campaign in California. So at this point in time, we don't have anything specific other than on the big signs over the highway other than a specific messaging that recreation areas are closed, but not specifically which ones. We did put up one of our portable signs. It's up between O'Byrne's Ferry Road and the split off to Highway 120. That one does say all recreation areas closed. It's right there as you're entering into the Jamestown, and then up Highway 108 there, and right before the turnoff to 120 towards Groveland, so that we can get the message out early, warn people as they're coming up. Hopefully they're listening to the radio stations as well, being able to hear some of our out-of-county and in-county broadcasting, and try and give people as much warning before they make the trip all the way up here. Because then, of course, the concern is that if there's nowhere to go at their destination, they're still here for the day. They don't want to waste a drive. So.
And my last request would be if you could share with the public all of those areas that you know to be closed at this time that are high recreational sites.
Absolutely. Like I mentioned, Pinecrest Recreational Area closed. There is broad closures along the Forest Service roads. That was issued in a press release earlier this week. Lake Don Pedro, Lake Tolic, New Melones, all of those recreation areas are closed along with the boat ramps.
And Madam Chair, I can validate that all of Maloney's and Lake Tulloch boat ramps are closed. I checked them this weekend. They're closed and barricaded.
And I had a question about the Forest Service roads. If not every Forest Service road has a gate on it, if somebody is out on a Forest Service road and they happen to be picked up by patrol, would they be kicked out of there, or what's the process there if you're on a forest road and you shouldn't be?
They'll be educated about the order and they'll be turned around.
Okay, great. And so there are people still patrolling those roads.
And I believe the sheriff may have something to add to that also.
While he's walking up, there are, just for the public, there are some people that actually do live off of those roads, and they are permitted access to their property.
So, good morning, Board. As stated in this presentation, we've been doing education since March 19th when the governor first came out with his stay-at-home order. Since that time, there's been a huge undertaking. It's all been outlined in this presentation, outlining the need to stay home and adhere to social distancing. During this time in the community, I think we've gained fairly good compliance. However, what's left are those who simply refuse to do the right thing. In light of Dr. Sinjenko's new order, which clearly defines all the activities which are to be followed, what's allowed and what's not allowed, to me, that's a very clear order. Coupled with the fact that after this Friday, we will have done 3 weeks of outreach to the public and education. I'm telling you that the sheriff's offices at that point will transition from education to enforcement, and we will be out proactively enforcing the doctor's order up to and including citations for those who refuse to obey the order. So, if that helps.
Thank you.
Questions?
Okay. Are there any other board questions for the team?
I have a couple of questions for Dr. Surzenko. First of all, just to reiterate what Sherry said, I went back and I looked at the last board meeting, and your credentials are amazing. I think we're extremely fortunate and lucky to have you here, so thank you. I think what you've done with UC Davis, again, what Brennan did is awesome. I think it's a great use of resources. I have a few questions, and I know the discussion around masks, and I wrote a little article about masks. If people could make their own and possibly watch a proper video on how to clean it, how to utilize it, would you recommend the community, everybody that can, go and make a mask and wear a mask?
So, yeah, I hate to be in a gray zone,
right,
but that's really where we are with masking. But if one were to wear a mask, I think that you'd want it properly constructed. And by properly constructed, create it so it's got 4 layers. I'm trying to get a cross weave on it. And then the important thing with it is it's, again, not helping you, it's helping out your community. Right. But the concern we have and the reason that we're in a gray zone is because you may inoculate yourself with the virus as you're donning or doffing that mask. So as you know, hand hygiene is critical. Those things that we've already talked about remain more critical than the wearing of masks. But again, given that asymptomatic, pre-symptomatic shedding of virus that can occur, especially when we shift from where we are right now, where we don't have evidence of community transmission, to where we have community transmission, wearing a mask may be appropriate. And I think that's where you're seeing the difference between yourself and I today, right, is I'm confident in saying we don't have sustained community transmission in the community. But I would probably say the balance in favor of wearing a mask will happen when we start seeing evidence of that. But again, properly constructed cloth mask. And then what I've been telling people, and as my daughter's been sewing them, is have 2 or 3 per individual, because what you want to do is be able to wash that each day and have a dry one ready to go for the following day, right, and reduce the burden of you getting inoculated with the schmutz that's in your own mask.
Right. So what I'm hearing is if you're going to do the mask, create it the proper way. But what's more important is the washing of hands before and after you take it off.
Exactly. Well, and again, all of those things that we've talked about before you mask, maintaining your distance, 6 feet, covering your cough, you're doing that with the mask, staying home if you're sick, critically important and emphasized in the Febrile Respiratory Illness Health Officer Order. And then hand hygiene, because again, as much as it's droplet spread, those droplets fall onto the surfaces around you. You do this, you scratch your nose, you scratch your eye, and then you've inoculated yourself.
Okay. Thank you. And then my last question, it had to do with the surge planning, planning for what may be coming. Based on other communities, other models, some of your research, is there a rough estimate or guess as far as percentage-wise what we might be looking like as a community? I know California, it looks like we've done a really good job of bending the curve a little bit compared to New York. But with the models you've been looking at, do you have an approximate what we might be looking at here in the next few weeks?
So I will say that models are all over the place.
Okay.
But what I've been looking at and what I've given as planning guidance to the surge planners is, again, we do have effective bending of the curve in California. I want to encourage everyone not to let up on that.
Right.
Keep staying at home. Keep doing all those things we've been talking about. That will keep the curve bent. But even if we have that bend in the curve, will look something like what the WHO mission to China found, which is about a 10% attack rate. And then from that 10% attack rate, that's about 10% of the population will get ill. Of that, 10% of those, maybe 12 to 15% will require some hospitalization. And then of the 10% that get ill, about 1% will die. And so those, I think, are critical planning factors that surge planners are looking at. Looking at the governor's estimates that were put out I won't say very early, but middle of March, those were based on not bending the curve,
okay,
where we were looking at a 56% attack rate and up to a 20% hospitalization rate. I think we've successfully done that in the Bay Area in bending the curve. I'm concerned about what I'm seeing in Los Angeles coming out of the LA Basin, where a lot of their hospitals are hitting surge capacity at this point. So that's why I'm having Dr. Nunez pay attention to that hospital data occurring in the LA basin and seeing what the trend is there and seeing if ongoing messaging to the Riverside community will shut down that or bend that curve.
Right. And I think what you said psychologically is real important because as people, even myself, start to see the curve bend, we see the stock market go up, we think, oh, we're maybe on coming out of this, but that's the most important time to continue doing what we're doing.
I think, again, in terms of the mitigation activities that we're doing right now, it's too early to lift them, but we still need to plan for what we do when we lift them because we can't just take them away and then slap on the accelerator and go back to life as normal.
Right.
What we have to think about is that interim period where we're still operating in a pandemic environment for 12 to 18 months until we start having a vaccine that's effective against this virus.
Okay. And then, so my last final comment is it looks like the worst of it for Tuolumne County is in the very near future, next 2-3 weeks possibly?
Potentially. It's hard to say. You looked at some of the models, University of Texas models, other models that say we'll probably hit something early May timeframe.
Okay.
So that's probably what we're going to look at as far as potential impact in this county.
Okay. Thank you.
And may I add one comment? So I just want your board to know as well that the Public Health Department, in conjunction with the hospital and our EMS folks, meet weekly on surge planning. So we're in ongoing conversations with those folks in consultation with Dr. Surgenko and our advanced planning folks throughout the region to develop strategies around surge planning on into the future, both from a facility standpoint, staffing standpoint, and supply standpoint.
Just have one question. You touched on the vaccine. So that development is ongoing. Is there any kind of indication of when that could happen, or do we just not know?
So right now, current vaccine development is in what's called phase 1 trials, which is essentially safety, not efficacy. So if I put it into someone's arm, does it cause harm? So we're seeing phase 1 trials for the first vaccine starting essentially in the next couple of weeks. But then once that happens, then you go into efficacy trial and say, does it actually work? And then phase 3 is actually when you put it into the population and do post-administration monitoring. And that takes time. So realistically, again, we're looking at a 12 to 18-month window from when we first isolated the virus back in January to where we have a vaccine that's available to us for mass distribution.
Okay. Thank you.
Supervisor Rotifer.
Yeah, again, Dr. Surgenko, I can't thank you enough. You've been awesome, as Sherry said. A lot of your team structure and everything that you put up, I recognized from my past. Very effective. I want to, this is more a comment to the public, because I'm getting a lot of traffic about people that are out and about. We got to remember that there are a lot of people that have legitimate reasons to be out and about. Our 3 largest employers in the county are the hospital, the county government itself, and the prison. So between those 3, there's several thousand people that are working still on a daily basis. So just because you see people out and about doesn't mean they don't have a good reason to do that. I'm trying to focus on those things that I can control in my life and not focus on the things that are under other people's control on a personal level. Obviously, I'm focusing on other things as a supervisor. But I just, for the sake of everybody's mental health as well, I think it's important that we don't unnecessarily raise our own individual anxieties. And that's natural. That naturally happens when you're isolated anyway. So I would just caution members of the public to do what they can to control their own anxiety level out there. I think it's very, very important. It'll help you with your family relationships. It'll help you if you do go to work with your interpersonal relationships when you're at work. So just something to think about. Again, Dr. Surjenko, I really appreciate everything that you're doing to help this county. We couldn't be in better hands, I don't believe.
Thank you, sir.
And before I go to Supervisor Gray, and I am going to make some additional comments under reports, but to emphasize the word team in this effort, again, is such an understatement. And the magnitude of the team that we have in place is nothing less than remarkable. And everyone, absolutely everyone, is stepping up to the challenge. So, Supervisor Gray, do you have a question or comments?
I just have a comment. Most of the things have been covered, but I would be remiss to give my personal thanks to the whole team, Dr. Surjenko, county staff. This is such a trying time, and I think as Supervisor Rutherford pointed out, if we do our part individually, we'll get through this. So, again, thank you. That's my comments.
Okay. So, at this time, I'd like to open it up to public comment. Again, I want the public to understand that we are going to, how we're going to do this is, some folks may have comments, some may have questions. I'd ask you to keep it to 3 minutes. We are going to be writing down your questions, and after everyone has had a chance to respond under public comment, we will go to staff and get some clarification on questions if we need to do that. So with that, do we have public comment?
All right, I'm watching this on my computer, and one of the things I'm noticing is that none of the supervisors are actually practicing social distancing now. And so here you've got the leadership, which if they can hold hands with one another, you know that they're within 6 feet of each other. 2 of them aren't even wearing masks, and I grant the fact that Dr. Surjenko has made his point while his daughters are making masks, or his daughter is making masks for people. That's a good thing. But you guys are actually looking at each other, speaking to each other, and you're keeping each other safe. So where could the virus come in? It's not going to come into the room from you guys specifically. It's going to come in from the outside. So Anaya works at the prison, and he comes to work there at the Board of Supervisors, so he's wearing a mask. Good for him. And he's protecting you. Because if he wasn't doing that, he could be spewing it on you. But then you've also got the sheriff, and he's working with all kinds of people who are coming and going. And some of those people are driving in, talking to some of his deputies, and then they're talking to him. And if he's a carrier, we don't know it. So I think one of the things we've got to do is actually stop it ahead of time. So when people come to our business, like there was a Comcast guy today, we made him mask up and wash his hands before he came in. You haven't done that. You guys haven't shown any kind of leadership. And for all the talk that you've got going there, Sherry, about practicing social distance, you're not doing it. So the model is horrible. And that's part of what the problem is you guys don't get it yet. I tried to tell you 5 weeks ago, and you cut me off. That's all I have to say at this point.
Is there any other public comment? I'm sorry, I can't hear you.
There's a delay on the video.
Okay.
So if we can wait 30 to 60 seconds, maybe 30 at this point, to give a chance for folks to call in.
Can you see when they come on? Okay, for the public that may be watching, we have a 30-second delay. Okay. Cece, do we have someone that is trying to get in under public comment? Okay. So seeing there's no further public comment, again, I want to express my deepest gratitude to the team. And this is an information item only. And for the public, again, their awareness, this team is meeting, different pieces of it are meeting literally. Some of the team members are meeting virtually every day. I do want to give Ms. Batista an opportunity to come up and just talk about revenue and what the implications are that we'll be seeing.
Hi, my name is Debbie Batista, and I'm the County Auditor Controller. And one of the things that I would like to make the board aware of are some of the actions that are happening at the federal and state level, and now how they're going to affect Tuolumne County. There is no number crunching here because it's way too early to figure out where we are. But there are some actions that both the governor and the federal government has taken that will affect us, and I want you to be aware of it. And in at least two of the actions, I think that we need to be a little proactive and help change some of it. So the first one happened on April 6th when the governor did Executive Order N40-20, which he did a sales tax payment postponement program, which allowed for all the sales tax that's due April through July to be paid by all the small businesses 90 days later. So this means that the sales tax that would have been paid for March by the end of April is not due until July, and then May is August, September, We're not going to go through how much sales tax we're going to lose because we have businesses not functioning right now. But what I want to talk about is the different areas that this is going to affect. It's going to affect our 1% Bradley Burns. It's going to affect our realignment 1991, which affects behavioral health, Department of Social Services. It's going to affect our public safety or our Prop 172, which affects the sheriff, the jail, district attorney, victim witness, county fire, animal control. It's also going to affect realignment 2011, which is behavioral health, Department of Social Services, all of the public safety entities I said, and also add public defender. It also affects public transportation, and even though public transportation isn't a county function, public transportation shares some of that revenue with the road fund. It's going to affect fiscal years 1920 and 2021. Again, the biggest area that it's going to affect is our cash flow. We're not going to receive these payments for 4 months. And it also will affect our interest earnings, not only for the pool, or not only for the county, but everybody that's in the pool, which includes the schools, the special districts, the county itself, and all of the county funds. The next one happens to be the Small Business Sales Tax Payment Deferral Act, or program that the governor would like to do, and that would be to postpone all small businesses paying their sales tax for 12 months. Absolutely understand why he wants to do that. Absolutely understands that it will help the small businesses get back on their feet. But one of the things that I think that we should be in support of is that because this has to be legislatively done, is that the payments can be deferred, but not the returns themselves, because this will give the California Department of Tax and Fees the ability to still send to the jurisdictions, the counties and the cities, what the actual tax collected should be so that we could do our estimates. The other two coming up would be what the federal government has done. So we have the COVID Sick Leave Act and the COVID Family First Act, and that will affect our employees. HR is already working with some employees to sign them up for those programs. However, that bill and that act has section 7000-E4, which says certain governmental employers, this credit shall not apply to the government of the United States, and it needs to change and have the period end there. The government of any state or political subdivision. So therefore, even though this act, our employees have the right to use it for almost every other entity, they can use those monies and apply it against their payroll taxes. We cannot. So we need to kind of work with RCRC, NACO, whoever we need to work with to change that and put the period after the government of the United States. This is probably the worst one. This is the ugly one, is, as you're well aware of, PERS lost probably somewhere around 20% of their investments for this fiscal year. Now, the fiscal year is not over. Again, we haven't crunched any numbers to apply it to us. We haven't crunched any numbers to apply it to us. I really did. But if we have about a 17% loss in our investment for the miscellaneous PERS in fiscal years 21, 22, it's almost a $1.5 million payment, additional payment on top of whatever we're doing. Because in 21, 22 is the year that we go to a 20-year roll, in a 20-year amortization straight instead of a 30-year roll up, roll down. Again, I believe that we need to work with our groups. I know that the auditors group is working to have PERS change that and at least maintain the 30-year roll up, roll down, because a $1.5 million hit to us will be really difficult as we're coming out of all of this. Again, we haven't crunched any kind of loss of TOT, loss of sales tax, loss of investments, loss from maybe the realignment and the property and the Prop 172, because the state's not getting these sales tax dollars either. So if they don't even meet the current year's level and it's less, all of those areas could have lost revenue. So that's my happy. Oh, I want to end in a really positive way. One of the things that is positive is that PERS has lessened the annuitants. We can actually work our annuitants more than 960 hours, and we don't need to have the 6-month waiting period. So some of the people who've retired in the last couple of months, if we need to bring them back, we don't need to go to the board and have you guys approve it. And we can actually work them more than 960 hours. So that's a positive out of all of this.
No board questions. I'm going to ask if there is any public comment on Ms. Batista's comments. Ladies, are we trying to get someone?
We do have somebody online who has a comment about the previous item and just a question for the public health staff. However, not for
Okay.
Ms. Batista.
Because of the very unusual circumstances, are they ready to speak? Hmm.
Okay, you're on. Ma'am?
Yes. Yes, I'm here.
Okay, you go for it. The board is available for you.
Okay, thank you. My question is that a day or two ago, Gavin Newsom mentioned the Abbott Industries working with 13 hospital systems in the state to open 75 testing sites. I'm wondering if we're in the queue for one of those testing sites, and how are we doing with testing material in the county?
So what I do know. Okay. So what I do know is that within the county at Adventist is that they do have the BD Max, which is not the Abbott system, and so that's what they're going to stick with. At this point, they have adequate testing supplies. But I am pursuing the Abbott for other entities in the region because, again, that's a rapid diagnostic. And just recently got emergency use authorization through the FDA.
This is an information item only, and so again, I want to thank everybody for being here, participating, and updating the board and the public. And with that, we will take a 10-minute recess.
I'm going to disagree with Dr. Surgenko. I don't recommend amendments.
The board meeting, will the clerk please read item 22?
This is consideration of adopting a resolution rescinding resolution number 1120 and revising the county allocation of homeless housing assistance and prevention assistance program funding and recognizing the COVID-19 emergency homeless funding.
And can you please let people know that if they want to comment?
If the public would like to comment on anything, I just wanted to remind you to call in right now, and the phone numbers
On
are
this item.
On this item only, 533-6581 or 533-6582, and your call will be placed in a queue now. Thank you.
Thank you.
Good morning, Madam Chair, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. In an attempt to be efficient, a little creative, and be respectful of the board's time, I've attempted to merge two similar board items into one. So after our presentation, I would appreciate your feedback if this does not meet your needs. As you recall, last summer, the governor signed into law the Homeless Housing Assistance and Prevention Program, also known as HHAP or HHAP. This one-time funding is designed to support a regional approach to address the immediate challenges of homelessness. As your board recalls, on January 21st, your board adopted a resolution to redirect the county's portion of the HHAP funds to our COC. The redirected funds were estimated to be a little over $423,000. In mid-March, we were informed by the state that the final allocation changed slightly. The new allocation is a little over $420,000, which reduced our original funding by about $3,000. To recognize this change, we're requesting your board rescind the January 2020 resolution and adopt a new resolution to redirect the updated funding amount. In addition, I've included a draft budget for your consideration, which is intended for your board to provide the COC direction on how the funding should be distributed within the budget categories. Also, on March 19th, the county was allocated a little over $110,000 in additional HAP funds dedicated specifically to COVID-19 related expenses. This allocation must be spent by the end of the fiscal year. I've included a draft budget for your consideration, which is intended for your board again to provide direction on how the funding should be distributed within the budget categories. In closing, we respectfully recommend the budget rescind Resolution 1120, adopt a new resolution to combine the redirected final HHAP allocation and the new COVID-19 allocation for a total of $530,362.83 to the COC. We also respectfully recommend your board approve the HHAP and COVID-19 proposed budget or provide staff with direction. With new direction, sorry.
Okay. Board questions, comments? None? Again, I'm taking that 30-second delay to look across the dais. Okay. Is there public comment on this item? Can I ask a quick question of staff? Can you see if someone is trying to get into the queue? You can, and there is no one trying to comment on this. Okay. In an abundance of caution, I am waiting. Supervisor Gray, did you have a comment?
No, I didn't. That's fine. Thank you.
Okay, I'm going to bring this back to the board, and I would remind us that it takes I believe this item is a 4/5 vote.
No. No.
I don't see it.
No, it is the next one. I'm sorry.
I move on staff recommendation.
Yes, the next one. Do I have an action?
Yeah, I move on staff recommendation.
And are we moving on recommendations 1 and 2 at the same time or each? Okay. Then I will second.
The motion by Supervisor Rotifer, second from Supervisor Campbell. Can we please have a roll call vote?
District 1, Sherry Brennan.
Aye.
District 2, Ryan Campbell.
Aye.
District 3, Anaya Kirk.
Aye.
District 4, John Gray.
Yes.
District 5, Carl Rutherford.
Aye.
All right. Thank you.
Thank you.
Will the clerk please read item 23?
This is consideration of adopting an urgency ordinance adding Chapter 8.60 to the Tuolumne County Ordinance Code to temporarily prohibit and suspend commercial and residential evictions arising from loss of income or substantial medical expenses related to COVID-19 coronavirus pandemic until May 31st, 2020, and this is a 4/5 vote. And if you would like to call in on this specific item to make a public comment, the number is 533-6581 or 533-6582, and I would suggest you call in right now for this item. Thank you.
Staff report.
Chair, members of the board, my name is Christopher Schmidt, Deputy County Counsel. As we're all aware, citizens have been ordered since March 19th to shelter at home in order to stem the spread of the COVID-19 pandemic. and this may last until May 31st unless terminated earlier or extended. As a consequence, residents and businesses have suffered loss of income, layoffs, reductions or closures of business, and this can interfere with things such as payment of rent or payment on leases to maintain business facilities. In response, government at all levels have implemented moratoriums from evictions in some form to lessen the effects of the shelter-at-home orders. The purpose is to help residents maintain shelter to comply with health officer orders and to soften the impact to businesses while they address interruption in revenue. Up until late yesterday, eviction moratoriums by the federal and state governments protected only residential tenants. Our local commercial tenants were still open to eviction. However, late yesterday, as you may have heard, the courts announced all evictions filed against any tenant will be subject to a delay of up to 90 days. That would be around July. But that does not prevent the filing of a complaint, and tenants not aware of the patchwork of relief may vacate without being required to do so. So right now, although all tenants, residential and commercial, have some relief from evictions, the relief varies and may not be consistent across all levels of government as time passes. Therefore, in this county, a uniform moratorium may still have some benefit. The urgency ordinance before you now is a broad, temporary moratorium prohibiting both commercial and residential evictions in the unincorporated areas of Tuolumne County. It only prevents evictions for non-payment of rent due to economic hardship from COVID-19, whether it results from loss of employment, loss of business, or medical bills. If a tenant notifies her landlord of a hardship, the landlord cannot take any formal action to evict until the moratorium ends. This ordinance would expire automatically when the authority given by the governor to the counties or local agencies to enact such protections expires, and that's scheduled to expire currently set for May 31st, 2020, unless that's extended. Although this moratorium to some extent duplicates federal, state, and court relief, this ordinance would supplement those protections and go further to close any gaps in protection should they arise. This urgency ordinance would not do a few things. It would not relieve a tenant's obligation to pay rent. A landlord can collect rent and initiate an eviction after the ordinance ends. It would not prevent eviction for matters unrelated to COVID-19, such as for damage to the facility or non-payment of rent unrelated to COVID-19. The ordinance would also not affect the county's ability to enforce health and safety code violations, such as red tagging a property. And finally, it would not prevent foreclosures on loans or mortgages, but it reiterates the governor's request to financial institutions to offer relief voluntarily, and many have already committed to do so. Given this is an urgency ordinance, it requires approval by a 4/5 vote. And if your board is inclined to approve it, we would recommend your board also waive further reading of the ordinance and make the findings as set forth in the ordinance recitals and the staff memo. I'd be glad to answer any questions you may have.
Any board, Supervisor Campbell.
So, this is just to clarify. So, if an individual, renter, is wants to apply to this, they have to inform the property owner that they are experiencing either some kind of job loss, layoffs, some kind of significant financial hardship directly related to COVID-19, or they're incurring medical costs related to the outbreak. They actually have to, they can't just stop paying their rent. They have to send a letter to whoever holds the lease on the property.
Correct. They would have to submit to the landlord some documentation of a substantial loss due to COVID-19.
Okay.
And it would not relieve the obligation to pay rent. It would just delay that.
And that was going to be my next question. So essentially when they send that letter, the clock starts for 90 days, and then at the end of that 90 days, you're still responsible for the rent. that you would have incurred over that period.
Yes, and as the ordinance is drafted, it's set to run concurrently with the governor's executive order that gives local agencies the power to enact such a moratorium. So whether that's shortened or extended, the life of this ordinance would match what the state is doing.
Okay. And then does the county fulfill any role as an intermediary with any of this? I mean, what is the county's role in enforcing this?
The ordinance allows for code compliance enforcement, but it gives tenants a defense. If an action for eviction, an unlawful detainer, is filed in court, they could assert this defense, and if they fall under the protections, they could be successful in the defense. The alternative is code compliance enforcement through Chapter 110, but primarily this would be self-policed by tenants.
Okay. Thank you.
Just, I know one of the unintended consequences of this is obviously if you're paying rent to the owner's going to have some same issue. They're going to have to, they're going to be short of cash to be paying on their loan. Is part of the reason possibly for the tenant to write a letter so that the owner of the property can utilize that letter for bank purposes to notify his bank of why maybe he may not or she may not be able to make the payment on the loan?
It could be used by the landlord to support reasons why they would be delayed in their payments.
And currently, like
or obligations.
And currently, like the governor did, there's a certain amount of banks that have been directed not to, I guess, foreclose or come against those landowners at this time, or those mortgage holders at this time.
I'm sorry, I didn't hear that.
So, from my understanding, if you could clarify for me, the governor's order or working with the banks. So, if I own the property and you're not paying me rent right now, isn't there a list of banks, 4 or 5 banks that are working with those mortgage holders if they can't make those payments?
Yes, I don't have the information on the banks that are cooperating with the state, and that would be voluntary on their behalf. But I understand that numerous banks are cooperating with the state and federal government to work with the businesses that are lending.
Okay.
Yeah.
All right, thank you.
Supervisor Kirk, I'll just say that I had the same questions because this really does become it's the next correct. And that was my understanding in reading this and looking at it, is this would also potentially have some assistance for those that need to reach out to their lenders and justify why they may be late on the mortgage payment. I know the governor is involved in those conversations, but I don't think there has been communication on from the state yet on exactly how that's going to play out.
Supervisor Brennan, there was in the executive order, which is probably what you both are referring to, some language that banks would be limited in foreclosing on loans for reasons that were outlined in the executive order. I just don't know all the details that Sarah and I were talking about. We could get some of those details and bring them and get them out to you at a later date. But I know that the same executive order did speak to the limiting banks foreclosing for such reasons that someone couldn't pay their rent during this period and that cascading event as a result of that. But we could get that more of that information to you after we have some time to do some more research.
Thank you. Any other board questions or comments? Supervisor Gray, do you have a question or comment?
No, it's fine. Thank you.
Okay. At this time, is there any public comment? No public comment in the queue, no public comment on the delay. So I'm going to bring this back to the board. Supervisor Rutherford.
Madam Chair, I move we pass urgency ordinance adding Chapter 8.6 to the Tuolumne County Ordinance Code to prohibit evictions arising from income loss or substantial medical expenses related to the COVID-19 pandemic.
I'll second.
I have a motion from Supervisor Rotifer, a second from Supervisor Campbell. A roll call vote, please.
District 1,
Aye.
District 2,
Aye.
District 3,
Aye.
District 4,
Aye.
District 5.
Aye.
Motion carries 5-0. Thank you. Okay, will the clerk please read item number 24?
This is consideration of adopting a resolution advising non-essential travelers to not enter Tuolumne County and to abide by the California Governor Newsom's stay-at-home order. And if you would like to comment on this item, please give us a call right now at 533-6581 or 533-6582.
And I would also remind the public that if you cannot stay on the line, you can give Heather or Cece your comments, and they will write them and forward them to the board. All right. So, staff report. This is an item that has come to us from Supervisor Kirk, and so I
Yeah, I'll go ahead and present it then. Okay, I wrote all my thoughts down on paper. So the purpose of this resolution is to save lives by educating non-essential travelers about the governor's stay-at-home order. If we save one life, I believe this resolution will have been successful. We know the virus is extremely contagious. It spreads asymptomatically and probably by aerosol, which is airborne transmission. There is a major risk to the vulnerable populations, 65 and older, and people with medical conditions. Tuolumne County has a large retired population. The U.S. Census Bureau says 26.2% are 65 or older. There are limited medical resources, especially hospital beds, ICU beds, and ventilators. Early on, the governor issued a stay-at-home order to flatten the curve. There has been success of flattening the curve. Just compare California to New York City. There's been anecdotal evidence of significant numbers of non-essential travelers to Tuolumne County, showing up at our hospital and buying goods at our stores. There's been anecdotal stories of non-essential travelers coming to the county and then inviting their friends to come join them. That is not social distancing and not staying at home. The first COVID-19 case likely performed by non-essential travel from Mono County. The second case apparently contracted the disease elsewhere and brought it home. Unclear if it was unessential travel. Other rural counties are requesting and even ordering non-essential travelers to stay home. On March 31st, Alpine County requests second home owners to stay away. On April 1st, Calaveras County Sheriff, Calaveras OES, and City of Angels Camp implore non-essential visitors to return to the primary place of residence and to not make trips to the area. On April 5th, Trinity County health officers ask all non-residents to stay home and out of the county. April 3rd, Amador County health officer orders a stop of all non-essential travel. On April 3rd, El Dorado County health officer orders a stop of non-essential travel into the county. On April 3rd, Tuolumne County health officer's order prohibits non-essential short-term lodging. On April 6th, Tuolumne County health officer's order banned non-essential gatherings of any size. And finally, on April 6th, Sonora City Council established fines for non-essential group gatherings and prohibits non-essential short-term lodging. At the beginning of this outbreak, information and news outlets said this was no worse than the common flu, said it was not asymptomatic and not aerosol, said not to wear a mask. But by the end of January and early February, there was strong evidence these points were not right. With common sense, I believe we can beat it. The suggestion is stay at home and wear a self-made mask. The coronavirus moves faster than government, so government needs to be quick. Maybe we don't get it perfect, maybe we don't, but we need to get on it and keep on it as and refine as we go. Let me say that again. We may not get it perfect, but we need to get on it, keep on it and refine as we go. Dr. Michael Ryan, a WHO executive director, said, "Speed trumps perfection. You need to get ahead of the virus." This resolution may or may not be the best way to try and limit non-essential travelers, but given the Brown Act and my inability to discuss this with other supervisors, this was the best way I knew how to moving forward. My resolution has two primary components. Request assistance from Caltrans in placing signs, additional signs, at major thoroughfares entering Tuolumne County, advising non-essential travelers to not enter Tuolumne County and abide by the governor's stay-at-home order. The second requests the capability of establishing educational checkpoints along major thoroughfares entering Tuolumne County, recommending non-essential travelers to not enter Tuolumne County and abide by the governor's stay-at-home order. As I've come to better understand the legal issues, I would be willing to change checkpoints into optional turnouts. Since authoring the resolution last week, I appreciate the work of county staff, legal counsel, and others who have reviewed and revised the resolution as another version, which is also before the Board of Supervisors today. However, I believe one point needs to be added to the revised resolution. I believe we need to request permission from Caltrans to allow optional educational turnouts along major thoroughfares entering Tuolumne County, advising non-essential travelers to not enter Tuolumne County and abide by the governor's stay-at-home order. Given how quickly this virus spreads, and given that our board will not meet again for 2 weeks, I recommend we take the strongest action possible now. Having the option for educational turnouts might turn out to be essential, and it may not be enough within 2 weeks, especially based on Dr. Surjenko's surge planning numbers, which he presented this morning, which states 10% of the population may be infected, 10 to 15% of those may be hospitalized. And of that 10%, 1% may be likely to die from this virus. Finally, life, liberty, and the pursuit of happiness are fundamental privileges we all enjoy. Of course, our liberties can only be extended to the point where we do not bring harm to others. During this crisis, we all need to do our part to prevent harm to fellow citizens caused by this extremely contagious virus. That is what my resolution seeks to do. And of course, as a crisis passes, we must undo all emergency orders and seek to rebuild and reestablish what was lost during this time. So with that, that is my proposal, and open for discussion.
So I am, first of all, I think that I want to clarify one statement that was made because I was on the city council meeting last night, and I can ask staff to get clarification as we are going through this item. But it is my understanding that they did an ordinance to educate and then fine, if necessary, those businesses that are considered non-essential that are still operating. So again, I'm seeing concurrence on that, so I just wanted to provide that for clarification. Now, what I'd like to do is, because so many of the pieces that you spoke to, Supervisor, are what this community, county, the leadership has been working so diligently at. And so articulating them, we were actually in the process of looking at an updated ordinance based on a lot of the moving pieces. And so at this point in time, I'd like staff to talk about the second alternative ordinance that is here, and specifically address, and I think it's really only one point that is significantly different. But so staff.
Thank you, Supervisor Brennan. So yes, Supervisor Kirk and I did work on this over the weekend and talking and letting him know all the different actions that we were able to accomplish last week. Where a lot of those did address Supervisor Kirk's concerns. However, one of the key pieces here, and he and I have discussed this, of concern is these educational turnouts. And I understand the reasoning for wanting the education, but my primary concern is I have no way, should we make that request and should it be approved and your board were to direct me to staff it, I don't have a way to staff that. And we could be putting others at risk if we were to ask them to be on the side of a highway somewhere and discussing and talking and being exposed to people they might not otherwise be exposed to, whether it be individuals who live here coming back and forth to work, or whether it be those who are traveling up the corridor here. But we did take a lot of action last week, and some of it was finalized on Monday. But as for those who don't know, we did work with the U.S. Forest Service and closing down some of those areas in which they had seen hundreds of cars come in the weekend before last. We did not see that this last weekend. And then the short-term rentals, Dr. Sarjenko did clarify that short-term rentals for non-essential business was essentially, that would not be, it's prohibited. So unless they're doing something that's outlined in state and federal guidance for what is essential, then they should not be doing the short-term rentals. He also put out something about and clarifying what the essential businesses were, and it was very detailed. So when everything, restaurants are okay, grocery stores, pharmacies, construction has been deemed essential by the governor, but such things as nail salons, hair salons, that those are non-essential. And there's a lot more detail. If anyone would like to see a copy of that order, we're happy to send it. And then the other thing we've been doing is we really have broadened out the education and outreach for really alerting those who come up and travel to our area. We, like so many other counties and even the states, are so dependent on those who come up and visit us every year. So we really have made a concerted effort to start reaching those individuals, letting them know that recreational travel is not deemed as essential, and we would ask that they would suspend and reschedule any such travel that they would be making at this time until the health emergency is over. So the primary difference in the resolution, the alternative resolution, is we've really highlighted a lot of the actions that your board and Dr. Sarjenko has already taken, and it kind of memorializes it for us. But the key thing it is missing is that these educational checkpoints or turnouts that Supervisor Kirk would like to see. And I'll defer to Sarah in case she has anything she'd like to add.
Sure. The only thing that I will add, and your board is aware of this, and again, understanding the concerns from everybody involved, the board does not have the legal authority under the current state of the law to implement checkpoints or the turnouts that would take state action. So that is why you don't see that language in the alternative resolution that the CAO's office and I worked on over the last several days.
At this time, I'd ask if the sheriff could come up because I have a question. And to some degree, this is a reiteration of what you said earlier, but I'm asking you to weigh in on the two potential ordinances. And then I'd also ask you to, you talked about the last couple of weeks, a campaign of education, and that that is changing. And if you could talk about what you're doing specifically with regards to your word's enforcement.
So in dealing with the two checkpoints, I would definitely defer to Sarah as to that. I think it would tax our capabilities as far as being able to staff something like that. As far as the enforcement part, I think it's been very clear all the work that has been done. Christina spoke about we're messaging Bay Area folks, we're messaging Valley folks, we're trying to get folks to not come up here, not be in our community, not come up here to recreate. Obviously, it's perfectly fine. There's no law against coming up and coming to your second residence and staying quarantined there. But as far as folks being out in areas that are closed, we are going to actively contact those folks, ask them to leave. If they refuse to leave, they're probably going to end up with some sort of citation. Does that answer your question?
Yes.
Sheriff, can I ask you a question?
Sorry.
It might be a gray line. I don't mean to put you on the spot, but what's the difference between asking somebody to leave on this road versus asking somebody to leave on a road coming into our community?
I'm
Are you
sorry.
specific to businesses? If you see somebody out of business, we may ask them to leave?
No. For instance, I was referencing the recent closures of all the rec areas. If folks are in an area that has been designated closed by the county health doctor or the U.S. Forest Service, those folks should not be in that area.
Gotcha. Okay.
Okay.
Thank you.
Or any of the closures that are listed on the alternative ordinance. Okay. I'm going to ask if my fellow board members have questions. Hang on. Supervisor Gray?
In looking at the long resolution, and it appears, and we did hear today that it's a duplication of a lot of things that we already have in place and are working on. My question is, and it has to do with anything that we do as far as when we set an ordinance, is how do we enforce it? Is it actually enforceable? And maybe that's a question for county council.
Sure. This is a resolution, so it's not an ordinance. Ordinances are legally
I apologize.
enforceable.
Yes.
This is more a statement of your board's intent and also a statement of all of the activities that have been going on and just clarifying for the public that non-essential travel is not allowed at this time.
Okay. So I totally understand that. I think the position that I'm looking at here is to defer to the council's advice, and then also the statement by CAO Riggs in that, how do we staff it? And my first question that I wrote down here was, who staffs them? Is it, public health? Is it the sheriff's department? I don't think we have the capabilities to do any of that. So, just my position.
So, additionally, I would ask that. So, Ms. Riggs, we were working on language for a resolution after looking at a few of the other rural counties, and we wanted to be very emphatic and direct. And the resolution that staff has developed addresses that, because some of the other government jurisdictions that we were talking to, and specifically with requesting closures, they were looking for the county to be direct and very pointed in what our health orders were. I see you shaking your head, but for the public's benefit, will you articulate why we do need a resolution that is direct?
Sure. So in working with some of the federal entities, especially, for instance, the Bureau of Reclamation, they specifically requested some very direct language so that they could use that in order to present to their higher up decision makers. And that is what allowed some of the closures to occur. So that, in conjunction with the health officer's order that was issued on Monday, has very direct language that is helpful to any of the entities that we are asking to help work with us to close down those type of facilities.
One of the things that Sarah and I we're talking about clarifying a bit is I'm seeing a lot of individuals referring to other jurisdictions' health orders. And we just want to make it clear, both Sarah and I have had conversations with our counterparts in those counties or cities' jurisdictions, and there's, I think, some misunderstanding. They are not enforcing those. So they have the same type of language that our health officers use about the type of essential travel that is allowed and that non-essential travel is prohibited. But they also are not stopping. So El Dorado and Truckee and Amador and Calaveras and so many others, they're adopting this language and further trying to message to their own residents as well as those, because so many of them also are so dependent on their tourism through every year, to just not come at this time. It's really not advised. But I do want to make sure that everyone who is listening, that they understand that they don't have checkpoints set up, and they don't have deputies checking their license and their residence information. It again is a message from their boards or their elected bodies about that really adhere to what the governor and our local, state, and local health officer has been advising for the health and well-being of everyone.
Okay, I'm going to ask if there are.
I have a comment. I'll wait till to see if there's public comment.
I want public comment.
Okay. Did you have?
Well, I just want to make some clarifications. Nowhere in does my proposed resolution say that we're going to check IDs or residents. That's not what I'm proposing. And I think, like I said, things are moving so quick. What I want to do is ask Caltrans, should things develop, can we have a designated spot where we could use an educational turnout? I hear that a lot of you folks are worried about how do we staff it. Maybe we don't staff it. Maybe it's a big board with informational purposes. Because just having a sign, I mean, I come from the prison. I've driven by that sign twice, and I've had to turn around and drive back to see it to make sure I'm looking at it. And so if the issue is how do we staff it, I don't know, we could be creative and build a big board and have posted information on it. So as people come in, we have a big arrow pointing to it to keep people from coming to our community, or to at least give them one last option. I think the point I'm trying to make is we can send newspapers out, we can do articles, and all those things are great, and they are going to have some effect. But the people who are still going to continue to come to our community to recreate, those are the people I'm trying to reach at that last threshold to try and turn around. So one thing that was also brought up was regarding it's unlawful to stop traffic along roadways unless there's immediate danger to life and or property. I know during the rim fire we were closing roads down and directing people because there's an immediate threat. There's a wall of fire. But nobody died in the rim fire. We have something that Dr. Surjanko has said is coming and is going to bring some death to our community. And so my point is there is an immediate danger. There's an immediate threat to life. And I'm not proposing that we enforce martial law. I'm not proposing that we close the road down. What I'm asking in my resolution is that we have a spot off the highway that should crap hit the fan, we can have a big billboard, and we can do the billboard now, educating people. And the whole point is to try and mitigate anybody coming in who might be containing that virus. And so I get everybody's concerns, but I want to be real clear. I'm not asking to check IDs. I'm not asking to check residents. People have the right, we live in America, to travel as they please. I'm just looking for that last checkpoint, that last chokehold before people come into our community, where there's a big informational piece to try and deter that last few percentage from coming in. And you know what? We can't control human behavior. I work in a prison. I make a living off of that. But I'm trying to mitigate it the best we can, and I think it's a critical piece of information that would, a visual that would really help that last piece. And what it also does is if things develop more quickly in the next couple of weeks, it gives us a spot where we already have a game plan. We already have the ability to start pumping out that last piece of information. So I'm just trying to get ahead of the game as quick as we can.
Okay. And just, again, I'm looking to Ms. Riggs as a point of clarification. The other resolution does have language about requesting Caltrans cooperation with signage, and because I do agree with Supervisor Kirk. I think that piece is really important.
It absolutely does. So it does say on, be it further resolved, the Board of Supervisors of Tuolumne County requests assistance from Caltrans in placing signs at major thoroughfares entering Tuolumne County and advising non-essential travelers not to enter and abide by the governor's stay-at-home order. That is one of the points in the alternative resolution.
Okay. At this time, I would like to go to public comment. And then I will take a 2-minute break.
Okay, I'm going to
practicing social distance at all. But in terms of a space that would be good to put a sign up or maybe some informational material for people, right across from the old Wink and Lantern, Rosalinda's is a huge place there where you could have people pulling off there. And in terms of staffing, we all know that at times the fire department will go ahead and fundraise using boots and things like that, and there may be fire department people that could staff that, especially this time of year. And then I know some of them have to be available for medical events as well. But also, I think we ought to think about the CHP and doing something cooperatively between our Sheriff's Department and the CHP. I think they work cooperatively periodically on various arrests, et cetera, and controlling DUI stops, et cetera. So if we could bring in the CHP, that'd be a great thing to do, and maybe that would alleviate some of the ticketing they do at the Stone Corral and do something a hell of a lot more useful. Thank you very much.
Thank you.
Number 2. David?
Yes.
Go ahead, you're on speaker.
Hello?
David?
Yes.
You're on speaker.
Okay, hello. Yeah, I just had a comment on this. You know, earlier on in the meeting that there was a lady that came on and said that they're doing all this outreach on social media and on the radio and different stations all over the place. So everybody has got this message. So why are we wasting all of this time talking about a resolution? And there's been staff time over the weekend. They've been going back and forth. Everything that you want done has already been done. So a silly little sign on the corner of 108 is not going to turn anybody around. Thank you.
Thank you. Are there any other calls? Okay. At this time, because we are taking voice messages that are being forwarded to our emails, I believe a couple of those have come in, and so I'd like to give the supervisors 2 minutes to go into their emails and look at those messages. Actually, let's take a 5-minute break. We'll reconvene at 11:35.
Have the radio warning on all our highways, 120 and 108. I believe it's the radio station 1660. Could we possibly look at see if Caltrans would be willing to put some sort of notice on that, and then with the flashing lights, people see that they could go to that radio station and get the information from that. Just a thought, something to look into.
Yeah, and I see Jason is shaking his head yes, and I'm sure you can hear that over the speaker. So thank you. Thank you. Good comment. All right. So at this time, I am going to bring this back to the board. And I'll start to my left, Supervisor Rotifer.
Sure. So this has been as limited an access as I've had because of the Brown Act, but this has been, I think, a moving target all along. So I don't want to belabor anything, but just to make sure the public understands that the county does not have the authority to regulate traffic on state highways if we wanted to. That authority rests with the state. But again, we're not necessarily talking about regulating it anymore, but I think it's important for the public to know that. So unless the governor were to act, then we would not be in a position to do that. The second thing, my understanding right now, and Ms. Riggs, you can let me know if I'm outdated on my understanding, but the governor has specifically told the CHP to not be in an enforcement mode on his orders. Is that correct?
That is correct. The lieutenant commander is actually part of our group that meets 3 times a week, and she's given us that update.
Okay, so the comment from the public about working with CHP, we have addressed that possibility, and that didn't work out well for us at this point. What I really want to talk about is, and I don't have a problem with having an option should we decide to do voluntary checkpoints. I think we always have that option. And we have our normal processes that we can do that with. I don't necessarily think it needs to be in the resolution. But I think that a lot of things have happened in the time period from when when Supervisor Kirk's original resolution was drafted and the point we're at right now that address virtually everything that his resolution does address. I'm not opposed to having another resolution. I do want it to be forceful, and I'm going to make a recommendation on the staff's alternate resolution here in a minute. But I think it's important to know that we have done a yeoman's effort in getting the word out, both inside and outside the county. And I agree with the other public comment that you almost have to live in a trash can with the lid welded on to not know what the health orders are in this county and this state and this nation. And I want to tell the people that are not following that guidance that you are endangering other people's lives. And none of us appreciate that. Let me say it again. For those of you that are intentionally not following the guidelines of our health officer, the state health department, and the federal government, you are endangering other people's lives. Think about that for a second. I think that we also have to, well, I won't go there. So I prefer, because I don't think that having an option to activate checkpoints is useful. I'm not sure Caltrans would let us do that anyway. We can talk to them about it, that's fine. But I prefer the staff's recommended resolution, but I want to make one change. And let me see if I can get to that real quickly. If you go to that resolution, I believe I've got the right one up, on the second, be it further resolved. So that would be, now therefore it be resolved, and then be it further resolved, and then the second, be it further resolved. I would prefer to say that the Board of Supervisors of Tuolumne County, rather than recommends, insists that citizens limit their travel to those activities that are necessary and essential, yada, yada, yada. And I would like to add another sentence that the Board of Supervisors, maybe it's another be it further resolved, but another paragraph that specifically says that the Board of Supervisors strongly requests that non-residents of Tuolumne County limit their visitation to Tuolumne County for only those specifically identified Tuolumne County essential activities. And if we can amend that, then I will be happy with that resolution.
Okay. So,
For a second.
no, just a second, because I want to give the other two supervisors a chance to comment. They have not had that opportunity yet, John. And then I'll be looking for a motion. Supervisor.
So, yeah, I mean, just about everything I was going to say has already been said. You know, I really, we all have a incredible desire to keep the public safe. That's pretty much all I've been thinking about for the past month. I think, you know, it's clear that the sticking point here is the turnouts, and I think I'm more in support of the alternate version because I think with the turnouts we're introducing potential dangers that we're not necessarily considering that the public and deputies face every day out on the highway, which is we're increasing the chances of traffic accidents or other kind of incidents that could happen. And I really don't think that those bad actors out there that are not following the state and federal guidelines, I don't think they're going to be deterred by this. And, you know, we're taking, just about down the line, we're taking every single other measure to ensure the safety of the community. But short of putting up barbed wire on the road, we're not going to keep those people out that are just not following the guidelines. And if we want to have that conversation, I'd be fine with that. But I'm definitely more in support of the alternate version.
Okay.
First, I want to thank staff, Tracy, council, because I know we had many discussions over the weekend since I first formulated the resolution. And I know a lot of things have transpired between then and now, and so thank you guys, and thank you all the county staff who have been working behind the scenes to make things happen. For Supervisor Kaikin, Dr. Surjenko, there's so many people who are working behind the scenes, and like Supervisor Rhoda first stated, it's a moving target. Things are moving and developing quickly. And I think it's for that very same reason, which is why I'm very persistent and very keen on keeping all of our options open and putting that in this resolution, that I would like an educational pass-through or pull-out. It doesn't mean it would have to be staffed or done now, but it would give us the options, because like everything has changed in just 1 week. I think everything is going to continue to change in the next few weeks. And so that was the purpose for my request for the resolution. Finally, in second, I know the city of Sonora has doubled down on talking, they passed last night, about possibly issuing citations to local businesses, people here. I know our public health director is doubling down on what's essential and non-essential, and the sheriff spoke today about how they may be enforcing that in the near future. And that's all for scientific reasons. It's all for good reasons. But I think the same approach needs to be taken towards not just our own constituents and our own businesses, but towards people who are going to come in and potentially spread the virus. So that is the whole premise for my last piece. I think the resolution that County Council and Tracy have come up with, I think it is far better, more detailed, and obviously a lot more information because of what's transpired the last week. But I really truly feel that between now and a few weeks, more is going to happen, and I want to have that extra option moving forward. So, so thank you guys for your work.
Okay, so just a couple of really quick comments. And I think staff is always exploring every opportunity
to inform and educate, and we heard a couple of points today that I think would be really advantageous for us to pursue, and without having them inclusive in this resolution. To Supervisor Rotifer's comments, I am looking at the language in that second, be it further resolved, and I'm asking for this consideration, that the Board of Supervisors of Tuolumne County insists that citizens, both residents and non-residents, limit their travel to those activities that are necessary and essential as defined by the state and federal guidelines, if that would meet your
State, federal, and our county guidelines.
Okay. All right. So I am looking for an action.
I'll move on Supervisor Brennan's recommendation.
I believe we've had public comment on this item.
We did.
Yes, we've had public comment. And so
I move on my the staff recommended resolution is edited by me, as edited by my edits edited by Supervisor Brennan.
Second.
A motion from Supervisor Rotifer, a second from Supervisor Campbell. All those, will you please take a roll call vote?
Before we do a roll call vote, can I just make one clarification?
Yes.
That Madam Chair, as the chair and as the coordinator for the EOC, has the authority to direct staff to do whatever she needs to have done between board meetings to be ratified by the next board meeting. So if we need something like a turnout or whatever, then that option is always on the table anyway.
And we'll let Supervisor Rotifer know that I am aware of that, and I will also let this board know that I have been in constant communication and working with both Ms. Riggs and Ms. Carrillo to get language that I think the majority of this board, through your comments, would be looking for. So with that, I believe there is a motion from Supervisor Rotifer, a second by Supervisor Campbell. Roll call vote.
District 1?
Aye.
District 2?
Aye.
District 3?
No.
District 4?
Aye.
District 5?
Aye.
Resolution is written by Ms. Riggs and Ms. Carrillo, passes 4 to 1. Okay. All right. Do we have time to do? We have 2 closed session items. Okay. Will you read the closed session items, and I will see if there is any public comment at this time for those items.
Closed session, conference with real property negotiators, Authority Government Code Section 54956.8, property is APN 007-070-003. Agency negotiators are Eric Earhart, and other parties negotiating is Robin Regina Hirsch. Under negotiations, price and terms of payment. The second one is conference with labor negotiators, Tracy Riggs, Eric Earhart, Ann Fremd, Kim Phipps. Authority Government Code Section 54957.6, all bargaining units. And,
Madam Chair,
go ahead. Supervisor Gray?
I have to recuse myself on the Hirsch matter. I own property within 500 feet of the property that is being considered.
Okay.
And if anybody would like to make public comment on these items, please call in now, 533-5681 and 533-5682, and there will be a 1-minute delay before we leave the room.
So we will wait to see if there is any public comment. We will, after that, be adjourning into closed session, and I am anticipating that we will reconvene at 1:30 for our 1:30 appointment, and then we will be continuing our closed session conversation after that 1:30 appointment. So at this time,
Is there any public comment? Anything in the queue? There is not, so we are going to recess into closed session. Thank you, everyone.
Due to the stringent standard, and many of the rural counties are non-attainment. But ozone is the only pollutant that Tuolumne County is non-attainment for. So this plan provides guidelines for notification and mitigation when there are very high ambient concentrations of ozone. Since ozone is classified as a secondary pollutant, the plan focuses on reducing the precursor pollutants, which are nitrogen oxides and reactive organic gases. And that's AKA NOx and ROG. There are 4 trigger levels associated with implementing the plan. For each episode or trigger level, there are notification and mitigation requirements that are commensurate with the ozone concentrations being experienced. Actions are implemented by the Air District with the help of local and state agencies and stakeholders. Many of the mitigation measures involve notifications such as to school districts to reduce or suspend outdoor activities. Other measures would be to advise the media and other county agencies of the situation and basically just get the word out. We would also be requesting industry to reduce emissions and request the public to reduce driving at some of these higher episodes. The overall message would be to make sure the public understands the severity and potential public impacts of very, very, very high ozone concentrations. The 4 stages or thresholds in the plan are the health advisory episode at 0.15 ppm, the alert episode at 0.20, the warning episode at 0.40 ppm, and finally the emergency episode when concentrations reach 0.50 and above. There's also the significant harm level that's discussed in the resolution and that we are trying not to reach or exceed. very important to note that the O3 concentrations of even 0.15 ppm at the health advisory level is very rare in California. There have only been 2 air districts in California in the last 10 years that have exceeded this 0.15 ppm threshold. Both are in Southern California with some of the worst air quality in the nation. The highest 1 hour concentration in Tuolumne County, as stated in the plan, was back in 2015 of 0.11 ppm, so 0.04 ppm less than even the health advisory episode. So, to reach even that health advisory level would be unusual. To reach the next level of alert level at 0.20 would be precedent setting. As stated in the plan, we believe ambient ozone levels will continue to trend downward, so the odds are low that we will ever have to use the thresholds in this plan. And we'll be coming back to the board in approximately 2 to 3 months to bring another element that's required in the SIP to the board for approval. And with that, I'd entertain any questions and request that you adopt the resolution formalizing the plan.
Okay, are there any board questions? John?
No, I'm good.
Okay, this is a public hearing, and so we're going to open the public hearing and ask if there are any public comments. And we're going to give it a little bit of time here. Okay, any ladies see nothing in the queue? No public comment? All right, we are going to close the public hearing, and I'm going to bring this back to the board.
Madam Chairwoman, I move that we approve the resolution as authorized by the Air Pollution Control Officer.
I'll second.
I have a motion from Supervisor Campbell, a second from Supervisor Kirk. Will the clerk please do roll call?
District 1.
Aye.
District 2.
Aye.
District 3.
Aye.
District 4.
Aye.
District 5.
Aye.
Motion carries 5-0. Thank you very much.
Thank you.
Okay. All right. We are going to return to closed session to finish our closed session items. Yes, thank you. We are going to reconvene as the Board of Supervisors. Thank you very much. And we are going to adjourn into closed session. Do we anticipate a report out? Thank you.
Both of them?
And we asked for public comment before we broke.
Are we going to hear both of them, or is just one?
We've
item?
already done one item.
So just item number 26 then?
Yes. Did
Okay,
you
I didn't
read
read it
these?
yet. No, I didn't read it
You
yet.
didn't read it before we went?
Well, I'm going to reread it right now.
You read them both, and I believe we asked for comment for both before we went to lunch.
Perfect.
All right?
Okay.
Okay, we are good. Thank you.